So thank you to Dr. Samir Dixit for joining us for this conversation today. You are joining from Nepal. You are a Luther grad and a doctor in medical researcher. So why don't you start by telling us a little bit about yourself and what your work involves?
Thanks, Victoria. So yeah, as you kind of introduced me very correctly, I'm a scientist. I come from a life sciences background. My doctorate degree is in the area of biotechnology, immunology and molecular biology. And I research in Nepal. I'm a researcher, and I wouldn't say I'm an expert in it, but my focus area is infectious diseases. What that means is I work with viruses, bacteria, and also I try to link life sciences with public health. So people call me a public health scientist in Nepal, just because I use my life sciences knowledge and try to understand how the diseases are affecting the community. So in a very short way, I've explained what I do. So I'm a scientist of life sciences background, working in the area of public health, focusing on infectious diseases.
It is not a coincidence that we've called you this evening because these are important skills in our world at the moment. So let me ask you, you graduated from Luther in the 90s. What was your degree in? Was it in biology?
Yes, so it was a BA in biology. And as you know, I mean, with a liberal arts background, Luther, I studied biology, but I didn't study only biology. I mean, I studied everything, which is amazing because now I realize that, even for me, even in the research I do, I have to deal with sociology, I have to deal with, some level of economics, some level of management, some level of anthropology, a lot of biology, a bit of health. So all that is, all this extra information that I learned while at Luther is coming into play right now.
You are living the liberal arts is what
I am living the liberal arts life that I, got to accustomed to in Luther.
Yeah. So you are, like, as you said, you're in Nepal, which is a world away from the experience of most of us here in Decorah. So can you tell us a little bit about how COVID-19 looks in Nepal, how people are handling it, what the response of the authorities is, like how are things in your hometown?
So Nepal has been hit quite low, at a lower level than what we see around us, especially Europe and America, right? Mm-hmm. And we have, so far as I do this interview, there has been 57 cases, no deaths, and out of 57, about 17 have already recovered and gone home. And even among those that are still in isolation because they have been detected as being positive, none of them are in severe condition, and they did not go to a hospital to be checked. It was one of those contact tracing mechanisms that identified them as being risk. They're gladly staying at home. They were tested and they found to be positive. So most of them didn't even know that they had the disease. So it's very strange. And from what I hear, it's not just Nepal, but a lot of developing countries, definitely a lot of countries in South Asia, India, Bangladesh, Pakistan, and Maldives, Sri Lanka, that have low cases. And Nepal is like that. But having said all that, we don't know at what stage we are. Maybe we're at the beginning stages. Although it's very hard to say that because we're very close to China. We have had tourists from China coming from November, December until we went to lockdown 37 days ago. And we have had a lot of migrant workers that go to India return because India started this lockdown also. And India, as you know, our bordering districts with India, Indian provinces with bordering Nepal have a number of cases. So our migrant workers that have gone to India, when they return, they have been bringing back the infection also, as we have seen. So yeah, so all that in place is still, with all that in place, we still think it's very strange that our caseload is quite low.
What might be an explanation? I mean, I think about you sitting in Kathmandu, which is a huge city. It's all of the indications are that you should have as big an outbreak as that size city anywhere else in the world, right? Especially with all the factors you just mentioned. So any idea why it would be that that's not happening?
No. I mean, look, Kathmandu, when everyone is here, it's about 4 million, the population. Mm-hmm. But now a lot of people have left to go to the villages, the things are shut down. We have been on shutdown for the last 38 days now. Sorry, not 37, 38. And that's a long time that we have ever had a lockdown for in our history. And even with that, like you're right, we would have expected a lot more cases and definitely a lot more severe cases and some mortality. Because if you go by world data, the 15%, up to 15% of the population must be hit at a very high level, and especially those of over 70 years of age. And there, among those, there should be some mortality figures. But Nepal and also Kathmandu, or entire Nepal, we have not seen, even by looking at hospital data, and the data that's coming from hospital, and the data that's coming from funeral sites and different places, even from households, no major increase in severely ill people with influenza-like symptoms or death. And hospitals are finding it very strange, as are we. So we don't know. It may be a couple of possible hypotheses. That one is that the BCG vaccine that's so well spread out in the media, a lot of developing countries, including Nepal, has had a BCG program that's against tuberculosis for the last 50 years or so. So sometimes people are saying that may be a reason that may be allowing us to have an enhanced immune system to be able to fight the disease better. And the second is Nepal has had multiple corona infections in children since long time ago. As you know, COVID is just one type of, HCOV2 is just one type of coronavirus. But there are at least 6 other types floating around in the population. And in Nepal, we know, there's been publications that shows human coronavirus have been in circulation for a number of years, and maybe ever since we can think of. So could that be a reason? We don't know. And also last thing is our age group. Nepal is a very young country. Our average age is in the low 30s, or actually the high 20s to low 30s, the average age. And our life expectancy is 72. So it's very hard to find people over 70 in our population. Hardly 2% of our population is over 70, and most of the population is under 70. So if you look at all that, then it starts to kind of make sense. But again, I suppose we have to see in the next coming weeks.
Yeah, it sounds as though we should be studying you.
This is why is being in developing country, seeing things from a very different perspective is so important in this whole global health scenario.
Yeah. So thinking about the global scenario and what we need to do next, because we don't have a vaccine. As you said, this is one of a million coronaviruses that exist in the world. What do you think should be the next steps on the global scene, and should they be different country by country? Should we attack it differently depending where we are?
So it's like this. One thing that's going to be global, where no matter where you are in the world, is that this virus is here to stay. Just like influenza A, just like other coronaviruses, this will circulate in the population for a long time. It's not like it's just going to go away. What is going to happen is, as it spreads in the population over many years, it'll take the form of a common flu. So we will have herd immunity. We will be able to fight it better. We'll be able to withstand it better. So in the next few years, and just like MERS, just like SARS virus, they have been in the circulation now. It's not like they have gone away. They're still here amongst us. Influenza A is amongst us, right? So we'll probably develop a vaccine. Even if we don't, after this year, maybe in the 21, 22, as we go along, this will be part of us. And we will fight it like any flu season. We may even have a corona season alongside flu season. So that's something we have to be prepared for. It's, in fact, in many ways, it's a good thing, because all of a sudden we have one less virus to worry about that we have some sort of immunity against. So that's one thing that's going to happen. So we have to prepare for that. So the challenge is not to fight it, but to live with it. Like what the French president said recently. Mm-hmm. We live with it. We have to learn to live with it. We take precautions. We take our measures. We take our safety measures that we have to do, social or physical distancing that we have been trying, hand washing, health and sanitation. All that is very important. But the virus is here to stay. So that's a global thing. At the country level, it depends where you are, I think. Mm-hmm. What you do practice in the US, what you practice in Europe, and what we practice in Asia may be different, just given the caseload. Mm-hmm. And we also have to start identifying the hotspots where the major infection is happening for the very immediate short term. Identify hotspots based on testing, and then isolate the people in the hotspot, and the rest of the population can move around freely. So what every country has to now start easing the lockdowns wherever there is lockdown, or official or unofficial. And US, I know there's not like no major lockdowns, but there are some informal type of lockdown happening.
State by state.
State by state, yeah, state by state. So in Nepal, we're in entire lockdown for the last 38 days, as I said. So in India is also. So I think slowly the lockdown has to be eased, with accepting that no matter what we do, no matter how much precaution we take, we simply cannot test everyone, and we simply cannot avoid infection if it exists in the population. And the good thing is it does not impact over 80% of the population in a major way. We just have to now start caring for and looking after the vulnerable population in every country. So that's how I think we should move forward.
It's a different way of looking. For me, it's a different way of looking at it, right? That our lifestyle has to change a little bit to accommodate it. Yes. And rather than to fight against it and conquer it, that's not going to happen.
We cannot conquer it. The viruses, you can never conquer virus. And we have to accept that this is a once in a century kind of event. Mm-hmm. So we have to accept it as being that. The chances of something very similar happening again, I mean, low. We may get regular outbreaks here and there, like we have had MERS, we have had SARS, and we have had H1N1, those will come. But the global pandemic of this kind, after 2009, now it's occurred, but 2009 influenza, H1N1, the swine flu was nothing, in the scale of things. It was also much bigger, in fact, in terms of the people infected, but the mortality was a bit lower, although it killed a lot of people over time. This one has come in a very big, it has been a big hit fast. It's come and then kind of done the damage. It's like a tornado. It's come in fast, done the damage, and it's going away. So when I say going away, it is going to stay. So we have to learn to live with the virus and probably let herd immunity kick in now. Vaccine, we don't know how long it will take. Like for me from Nepal, I don't think it will be a priority for vaccine because we don't have too many cases. The priority will always be in the places where there's been a lot of cases where a lot of people are dying. So that's how the priority will fall into place. And I don't think Nepal will be top of the ladder when it comes to being provided a vaccine yet.
You might be close to Iowa on the ladder. So my next question really is about back to the college. We have, as you know, a global health major that we've been working on for a couple of years, actually with you, because your research center might be one of the host sites for our students.
Yes.
What would you say to a student that's thinking of coming to Luther and majoring in global health? Is that it seems to me like it's a good place to be going forward.
Can I say anything more? Look at the timing. Right now, one thing this pandemic has shown us, the word pandemic is across the globe, right? It is no better time than now to realize how viruses and bacteria and infections spread across the world and how every country is connected to some other country. Where did it start from? Well, from what we know, it started from one small town or major town in China. It spread and then went to Europe, then it came back to America, then it's going down to Asia, Africa. Look how well it's connected. It's a global world out there. It's interconnectivity is amazing, isn't it? So in a situation like that, with that background and with that backdrop, isn't it important now that we start taking every disease, every infectious disease as a threat to humankind? So therefore, every country has to be prepared, and every country has to talk to another country for even a slight indication of something happening. It may be US one day, it may be Asia one day, it may be India the next day, it may be Latin America the next day. So we do not know. So therefore, global health is such an important area of understanding or studies. So I'm glad Luther was about to start. And yes, I have been engaged from the very start to give advice and suggestion. And I would love to, take part in this very soon. And I'm looking forward to, working with Luther in this area. And I think we have a lot to learn from each other. What we have seen in Nepal, or what we haven't seen in Nepal, or what you have seen in the US, what you haven't seen in the US, can be interconnected and a lot to learn from each other. And these are I'd love to, I hate to say this, but these are also exciting times in terms of science, in terms of understanding disease. if you look at the social aspect, these are terrible times. But from scientific perspective, from public health perspective, these are also exciting times, because now we're starting to understand a lot of these emerging diseases, and I think we have to move on.
Yeah, and there is no public health that's not global these days.
Absolutely,
Everything
absolutely.
is global. Well,
Absolutely. It's all about understanding the global context, from a local perspective, but with the knowledge that whatever you think at a local level, something global is going to hit us at some point or the other, as it is happening right now.
yeah. Well, yeah, on behalf of Luther College and the Center for Ethics and Public Engagement, we are grateful to have you as our as one of our alumni, and also grateful for your partnership in this new major. And so we look forward to many years of work with you.
Thank you. Thank you. I just wanted to point out something that for the last 5 years, we have been working with the USAID, which is a US government agency, and University of California, Davis, on surveillance of RNA viruses of zoonotic nature. That includes corona. And a recent paper by us, which is going to be published very soon, my friend is handling that, but it's part of our organizational work that we do, has identified corona in some of the animals that we have been using for surveillance, and even some humans, non-COVID too, but human COVID. And stuff like that is something we've been doing for the last 5 years. So we have a lot of experience and expertise in surveillance of these kind of zoonotic viruses. The COVID virus is a zoonotic RNA viruses. And we have been doing this work for the last 5 years. So stuff like that, I look forward to, learning more and hopefully spreading that information more in the coming days with Luther.
I'm excited for what our students can learn from you and your fellow scientists. Thank you so much for talking with me. I appreciate it.
Thank you, Victoria, and I look forward to talking again and interacting more.
Me too. Thanks.
Bye.